Menopause is a change in a woman's hormonal status.
Generally around 49 to 51 age range, the ovarian production of those hormones starts to decline significantly.
Common symptoms include hot flashes, brain fog, trouble sleeping, decreased libido, irregular periods, and mood swings.
Everyone's different and everyone experiences this phase of their life differently.
Dr. Jeff Smith says it's important that you speak with your OBGYN about any changes you may be experiencing.
There are multiple different modalities with which we can manage these symptoms. The most effective is hormone replacement therapy. The goal with hormone replacement therapy is to get you on the lowest effective dose for the shortest duration of time in order to manage these symptoms and kind of regain your quality of life.
Dr. Smith says FDA-approved hormone replacement therapy is safe as long as the provider performs their due diligence screening patients for any known cardiac risk factors or any possible contraindications to therapy.
The best time to initiate this, if the patient elects for hormone replacement therapy and it's safe, is really actually in the perimenopausal years. And that can start 5+ years before actual menopause.
Non-hormonal methods are also available. Speak with your OBGYN about what may be best for you. You can learn more by searching for obstetrics and gynecology on lehealth.org. For Lee Health, I'm Devin Turk.